The Santa Barbara County Public Health Emergency Preparedness Program presents the COVID-19 and Flu Vaccination Pod training recorded on May 20th, 2022. The agenda for this training includes 1. Clinic function and staff roles, including organizational chart, roles and responsibilities of staff members, as well as dress code and PPE. 2. Layout and workflow of a pod, including clinic setup and cleanup, as well as the day of clinic flow. Number 3, vaccine information for both COVID-19 and influenza vaccines. 4, documentation in my turn on paper screening forms, as well as the CDC vaccination cards. And 5, safety plans, where we'll review quality assurance, medical emergency and incident reports, traffic safety plan, weather, and PIO. Clinic function and staff roles. At each clinic, there will be a variety of staff. We'll provide a general overview of each staff role and associated duties. Staffing structure. This staffing structure displayed is the bare minimum for a vaccination pod. More positions may be activated for larger clinics. The basic staffing structure for each pod should include a pod manager, safety officer, public information officer or PIO, vaccine manager, vaccinators, observation and first aid area, registration, scribe, and logistics. The incident command staffing structure can be used for small or large pods and scaled to include additional positions as needed. For smaller clinics, one person may be assigned to multiple positions. This will depend on the clinic size and population being vaccinated. For larger clinics, additional staffing positions may be added, such as MDs to provide medical consults, translators, line and traffic control, or education staff. Next, we'll discuss each role in more detail. Pod manager. The pod manager is responsible for the operations before, during, and after the clinic. Before the clinic, the pod manager should analyze the layout of the site to plan how to best organize the clinic, coordinate with the logistics team to ensure an adequate number of supplies are packed for each clinic, identify how many staff members are needed for that clinic and have a plan for scheduling their shifts, stay current on CDC guidelines to be able to answer any questions about COVID-19 vaccines. During the clinic, the pod manager should oversee all clinic operations and manage all staff, brief all staff on the clinic operations, vaccine offerings, and review any updated guidance, answer questions from staff and refer them to the CDC guidance to counsel patients, support staff as needed by assisting with registration or scribing. After the clinic, the pod manager should ensure all patient information is stored securely and documents with PHI are properly discarded, and all remaining vaccine is accounted for, properly stored, and transported appropriately. The PIO and Safety Officer. The Public Information Officer, also known as PIO, is responsible for promoting clinics and communicating with the media. Before the clinic, the PIO will alert the public about vaccine clinic availability through various media platforms, including social media. During the clinic, if the media arrives, the PIO will be contacted to greet and direct press as well as determine talking points for any interviews. The safety officer is responsible for overseeing the safety of all staff and patients during the clinic. This includes ensuring all vaccinators are properly trained, monitoring all stations within the clinic and correcting any hazards, and halting any operation that poses an immediate threat to any staff or patient. If the PIO and/or safety officer position is not designated to a staff member on site, the pod manager will also fulfill those duties. Registration. Registration staff are responsible for verifying each patient's identity and eligibility, checking in each patient using MyTurn, and providing vaccination information to each patient. There are some important handouts that are given to patients to provide more information about the vaccines. Each patient should be offered an EUA or vaccine fact sheet and information on potential side effects. Patients who register ahead of time on My Turn will have received an electronic copy. Hard copies will also be available at the registration table. Patients do not need to accept the handouts, but they must be offered. EUAs are especially important for patients who have never had a vaccine before or were vaccinated in other countries and are now getting an FDA-approved vaccine for the first time. Patients who would want to know about potential side effects and aftercare instructions for each vaccine should be provided with the What to Expect After Getting a COVID-19 Vaccination for COVID-19 vaccine recipients, or the VIS for Inactivated Influenza Vaccine for flu vaccine recipients. Vaccinators. Vaccinators are responsible for screening each patient and reviewing any considerations with a yes answer, referring to the guidance in the CDC pre-vaccination checklist. During a larger clinic, there may be an assigned screener position. In this instance, the patient will be screened by the designated screener, meaning the vaccinator may skip the screening step and continue on to verify and administer the vaccination. The vaccinator will also verify each patient identification, eligibility, and vaccine product. Administering the vaccine using the correct needle size, dosage, and route. Documenting the vaccination on each patient's card, as well as on My Turn. Providing aftercare instructions and answering any follow-up questions. Maintaining a safe vaccination environment by practicing hand hygiene after each patient and vaccinating patients with a history of syncope on a cot. Assigning an observation period of either 15 or 30 minutes based on the patient risk, such as history of anaphylaxis. Scribes. Scribes are responsible for documenting patients' information correctly in My Turn, each vaccination electronically in My Turn, and any immediate adverse reactions that occur after vaccination, such as syncope. Depending on account accessibility, clinic size, and population being vaccinated, a scribe may be assigned to each vaccinator, or vaccinators may scribe for themselves. Vaccine managers. Vaccine managers are responsible for managing all vaccines. This entails 1. Monitoring the temperature and distribution of each vaccine, ensuring the temperature is within range and making adjustments as needed, distributing vaccine to each vaccinator, and recording the number of doses drawn and wasted for each vaccine product. 2. Ensure all vaccinators are adequately stocked with the correct vaccine, lot number stickers, and medical supplies. 3. Analyzing the clinic flow to determine how each vaccine should be drawn to avoid wasting vaccine product. 4. Recording temperature and ensuring the temperature is within range and making adjustments as needed, and recording vaccine inventory, including doses wasted, doses administered, and doses remaining on the chain of custody form. 5. Supervising all vaccinators during the clinic to ensure all vaccination protocols are being followed. 6. Training vaccinators and check off their skills using a vaccinator competency checklist, which we'll show on a later slide. This includes supervising the return and storage of unused vaccine and maintaining adult and peds EpiPens. Observation. Each patient who receives a COVID-19 vaccine is required to wait in the observation area for a minute of 15 minutes before leaving the clinic. Observers may be an EMT, paramedic, nurse, or physician, and are responsible for monitoring patients during their post-vaccination observation period, watching for any signs of anaphylaxis, vasovagal syncope episodes, anxiety, or any other immediate adverse reactions, as well as managing the first aid station and AED. The CDC advises certain patients to wait 30 minutes instead of the standard 15 minutes. Vaccinators are advised to assign a 30-minute wait time to patients with a history of allergic reaction to a vaccine or injectable medication, or any history of anaphylaxis. Dress code. The dress code for our clinics is designed to keep staff safe and help patients easily identify staff. Closed-toe shoes are required. They should be comfortable enough to move around in during your clinic. A work uniform, scrubs, or other appropriate work clothing must be worn. For larger pods, staff will wear an incident command vest with a name tag. Each vest color corresponds with each staff member's position. For example, all vaccinators will wear a red vest, and all administration staff will wear a blue vest. Note, clinics may be outside, and you may want to bring some extra supplies. This may include sunscreen, extra layers of clothing, a hat, or a personal water bottle and snack. Plastic water bottles will be provided on site. Personal protective equipment, or PPE. All staff is required to wear PPE during all of our clinics to protect themselves and patients. A surgical mask or N95 must be worn at all times during the clinic. A face shield or goggles may be required depending on the community transmission level. Eye protection is required in areas of moderate or substantial community transmission. Eye protection is optional in areas of minimal or no community transmission, unless otherwise indicated as part of a standard precaution. Gloves are not required to be worn. If the vaccinator chooses to wear gloves, they should wear one glove on the hand that touches the patient, change the glove after each patient, and remove the glove to practice hand hygiene before and after each patient. Hand hygiene must be performed before and after each patient. Hand sanitizer will be provided at each pod for all staff to use. Using gloves does not replace hand sanitizing. Vaccinators must wash hands with soap and water or use hand sanitizer before touching each patient, regardless of glove use. COVID-19 vaccination safety procedures. These are the CDC recommendations. All staff should adhere to the following safety guidelines during each clinic. Personnel with symptoms consistent for COVID-19 infection are advised not to attend our event. Persons in line should be spaced out at least 6 feet apart. A 15-minute observation period is established with chairs evenly spaced out. All participants must wear a mask. Clinical personnel are required to wear surgical masks or higher grade and offered a face shield or goggles if clinic is indoors. Hand sanitizer should be used between each patient. If gloves are worn, they must be changed between each patient and hand hygiene must be performed. Hand sanitizer over gloves may be used if gloves must be worn and there is a current shortage of gloves. Maintain a distance that prevents close contact between participants and staff. Decontaminate pens, iPads, and other materials after sharing them with patients or other staff members. Disinfecting wipes and sprays are available for this purpose. Sharps containers should be taped shut and stored in plastic boxes between clinics. Site layout. Clinics will be held at various locations, therefore the layout for each site will vary. We'll review how to set up a vaccination clinic no matter the site. The CDC recommendation is to focus on venues that are accessible and large enough to handle the expected amount of patients. Example of spaces can be vacant stores, school gyms, or church halls. Planning the site layout. Although each site is different, we strive to create a one-way flow through each clinic. Before setting up the clinic, the pod manager will analyze the area and create a layout that allows consecutive movement through registration and check-in area, vaccination area, and observation area. A one-way flow should be created from registration through the vaccination station and finally to the observation area. The CDC recommendation is when assessing a vaccination venue to note the accessibility, safety, and security of each site. Ask yourself if it has accessible restrooms, enough space to provide a waiting area and seating, adequate lighting, and the capacity to accommodate everyone with social distancing. Also, if the vaccination clinic is outdoors, ask yourself how the weather may affect the vaccine clinic. Example of a clinic setup. This image depicts an example of a clinic that is set up with a one-way flow. On the left-hand side, patients enter through the parking lot and arrive at the registration area, where one line is designated for people who have appointments and another line for walk-in patients. Once patients have checked in, They're then directed to the vaccination area, where patients wait in a line designated by vaccine type. After receiving a vaccine, patients are then directed to the observation area. Once their observation time is complete, patients then exit the clinic towards the exit on the right-hand side. This setup allowed for the clinic to have a one-way flow. One-way flows should be used whenever possible during clinics. Supplies for site setup. One important aspect of setting up a site is ensuring there will also be adequate supplies. This may include tables for each station and chairs for both staff and patients at each station, table paper to keep vaccination tables clean. Signage is especially important to direct clinic traffic. Some clinics may require more signage than others. When looking at the layout of the site, note where signage may be needed. For example, exit, entrance, or wait here. A-frames are great for large signs. Traffic cones and caution tape are also helpful for designating lines and directing patients to specific areas. The day of the clinic. What to expect? So what can you expect on the day of the clinic? Setting up the clinic includes using signage, cones, and caution tape to direct patients through the clinic and ensure each station is set up with adequate supplies and is clearly identified. Before the clinic begins, the pod manager will brief all staff on the clinic operations, vaccine offerings, and review any updated guidance. Lunch breaks will often be staggered to allow the clinic to stay open continuously. Staff may take eating, drinking, and restroom breaks during the clinic. Once the clinic is closed, staff will need to clean up all stations and put away all supplies. Make sure to clean up all trash and leave the area as it was upon arrival. Meals. Meals are not provided during the clinics. Please make sure to eat before you arrive. Meal breaks will be given for shifts that are over 4 hours. Please bring a lunch or have a plan to purchase a meal nearby, and make sure to research nearby eateries ahead of time. Water will always be available on site, and snacks may be available from time to time. Transportation and parking for staff. Each staff member is responsible for their own transportation to each site. Carpooling may be available for specific locations. Parking varies per site and is communicated to staff ahead of time. Please contact your pod manager with specific questions about carpooling and/or parking. Vaccine information. General COVID-19 and flu vaccination information. Now that we've discussed each role, we'll review the vaccine information that will be provided at each pod. Even non-medical staff should be informed of the CDC guidance for each vaccine. Keep in mind, vaccine information, especially for COVID-19 vaccines, is updated often. Be sure to check with your pod manager or vaccine manager for the most up-to-date vaccine information. COVID-19 vaccination language. All pod staff should be familiar with COVID-19 terminology. The first term we'll review is primary series. This term refers to, for most people, a 2-dose series of an mRNA COVID-19 vaccine, either Pfizer or Moderna, or a single dose of the Janssen COVID-19 vaccine. For people who are moderately or severely immunocompromised, a 3-dose series of an mRNA COVID-19 vaccine or a single dose of Janssen COVID-19 vaccine. Additional dose refers to a subsequent dose of vaccine administered to people who are less likely to mount a protective immune response after initial vaccination, and people who are moderately or severely immunocompromised and who received Janssen COVID-19 vaccine for their primary series should receive an additional dose. Booster dose. This term refers to a subsequent dose of vaccine administered to enhance or restore protection, which might have waned over time after primary series vaccination. Up to date. This term refers to a person who has received all doses in the primary series and 1 booster when eligible. Getting a second booster is not necessary to be considered up to date at this time. Types of COVID-19 vaccines. Pfizer and Moderna are both messenger RNA or mRNA vaccines. mRNA technology is new but not unknown. It has been studied for more than a decade. mRNA vaccines do not change or interact with the recipient's DNA in any way. They do not cause the live virus that causes COVID-19 disease. and they do not give the recipient COVID-19 disease. Janssen COVID-19 vaccine is a viral vector vaccine. This vaccine type has been well studied in clinical trials, and viral vector vaccines have been used to respond to recent Ebola outbreaks. Viral vector vaccines do not affect or interact with the recipient's DNA in any way and cannot give the recipient COVID-19 disease. COVID-19 vaccines for adults. COVID-19 vaccines available in the United States are effective at protecting people from getting seriously ill, being hospitalized, and even dying, especially people who are boosted. As with other diseases, you are protected best from COVID-19 when you stay up to date with recommended vaccines. 3 COVID-19 vaccines are authorized or approved for use in the U.S. to prevent COVID-19. Pfizer, also known as Comirnaty, has been fully approved by the FDA for persons aged 16 and older and has FDA emergency use authorization for persons aged 5 to 15. 0.3 milliliters is administered for the primary, additional, and booster doses. Moderna, also known as Spikevax, has been fully approved by the FDA for persons aged 18 and older. 0.5 milliliters is administered for the primary and additional doses, and 0.25 milliliters, a half dose, is administered for the booster doses. J&J, Johnson & Johnson, Janssen, has FDA emergency use authorization for persons aged 18 years and older. However, the CDC recommends mRNA vaccines over the J&J vaccine when possible. 0.3 milliliters is administered for the primary and booster doses. Note, due to adverse reactions, the mRNA vaccines are preferred. The Pfizer COVID-19 vaccine primary series consists of 2 doses given 3 to 8 weeks apart. 2 weeks after the final dose in the primary series, the recipient is considered fully vaccinated. 1 booster dose of either Pfizer or Moderna is recommended at least 5 months after the final dose in the primary series. Adults ages 50 years of age and older can choose to receive a second dose of either Pfizer or Moderna at least 4 months after the first booster. Up to date means immediately after getting your first booster. Moderna. The primary series consists of 2 doses given 4 to 8 weeks apart. And 2 weeks after the final dose in the primary series, the vaccine recipient is considered fully vaccinated. 1 booster of either the Pfizer or Moderna COVID-19 vaccine is recommended at least 5 months after the final dose in the primary series. Adults ages 50 years and older can choose to receive a second booster dose of either Pfizer or Moderna COVID-19 vaccine at least 4 months after the first booster. Vaccine recipients are considered up to date immediately after getting their first booster dose. Johnson & Johnson Janssen. The primary series consists of 1 dose. Vaccine recipients are considered fully vaccinated 2 weeks after the 1 dose. 1 booster of either Pfizer or Moderna is recommended at least 2 months after a Johnson & Johnson vaccine. Anyone who received a Johnson & Johnson vaccine for both their primary series and booster dose may receive a second booster of either Pfizer or Moderna at least 4 months after the first booster dose. Adults ages 50 years and older can choose to receive a second booster dose of either Pfizer or Moderna at least 4 months after their first booster. Vaccine recipients are considered up to date immediately after getting their first booster. The FDA limits the use of Johnson & Johnson COVID-19 vaccine to certain individuals. After conducting an updated analysis, evaluation, and investigation of reported cases, the FDA has determined that the risk of thrombosis and thrombocytopenia syndrome, TTS, a syndrome of rare and potentially life-threatening blood clots in combination with low levels of blood platelets with onset of symptoms approximately 1 or 2 weeks following administration of the Janssen COVID-19 vaccine, warrants limiting the authorized use of the vaccine. FDA limits the authorized use of the Janssen COVID-19 vaccine to individuals 18 years of age and older for whom other authorized or approved COVID-19 vaccines are not accessible or clinically appropriate, and individuals 18 years of age or older who elect to receive the Janssen COVID-19 vaccine because they would otherwise not receive a COVID-19 vaccine. The FDA has determined that the known and potential benefits of the vaccine for the prevention of COVID-19 outweigh the known and potential risks for these individuals. The COVID-19 vaccines for pediatrics. The Pfizer pediatric vaccine for 6 months to 4 years old is still pending approval. The Pfizer pediatric vaccine for children ages 5 to 11 years old is approved under Emergency Use Authorization for children ages 5 to 11. This is a 2-dose series consisting of a 0.2 milliliter dose for their primary, additional, and booster dose. This vaccine requires a diluent. The Moderna pediatric vaccine is also still pending approval. COVID-19 vaccine for children ages 5 to 11. Children ages 5 to 11 are only eligible for the Pfizer pediatric COVID-19 vaccine. They are eligible for a primary series and a booster. Moderately and severely immunocompromised children are eligible for a 3rd dose. Note that the Pfizer pediatric COVID-19 vaccine is a different formula than the Pfizer COVID-19 vaccine. Be cognizant of the patient's age. Patients ages 5 to 11 years old should only receive the Pfizer pediatric COVID-19 vaccine. Patients ages 12 and older should receive the Pfizer COVID-19 vaccine. COVID-19 vaccine for children ages 5 to 11. Children ages 5 to 11 years old are only eligible for the Pfizer pediatric COVID-19 vaccine. Their primary series consists of a 1st and 2nd dose. They are also eligible for a booster dose. Moderately and severely immunocompromised children are eligible for a 3rd dose. This is an additional dose. Note that the Pfizer pediatric COVID-19 vaccine is a different formula than the regular Pfizer COVID-19 vaccine. It's important to be cognizant of the patient's age. Patients aged 5 to 11 years old should only receive the Pfizer pediatric COVID-19 vaccine, while patients 12 and up should receive the regular Pfizer COVID-19 vaccine. COVID-19 vaccine for children ages 12 to 17. Children ages 12 to 17 years old are only eligible for the Pfizer COVID-19 vaccine. The primary series for this age group consists of a 1st and 2nd dose. Moderately to severely immunocompromised children are eligible for a 3rd dose. Children in this age group are also eligible for a booster dose. 2nd dose timing. People ages 12 to 64 years, especially males ages 12 to 39 years, should consider getting the 2nd dose of an mRNA COVID-19 vaccine 8 weeks after the 1st dose. A longer time period between the 1st and 2nd doses may increase how much protection the vaccine offers and further minimize the already rare risk of heart problems, including myocarditis and pericarditis. People ages 5 to 11, people ages 65 and older, and people more likely to get sick from COVID, or anyone wanting protection due to high levels of community transmission, should get the 2nd dose of Pfizer COVID-19 vaccine 3 weeks after the 1st dose, or the 2nd dose of Moderna COVID-19 vaccine 4 weeks after the 1st dose. Mixing COVID-19 vaccine products. The CDC does not recommend mixing products for your primary vaccine series. If you received a Pfizer or Moderna COVID-19 vaccine, you should get the same product for your 2nd shot in the primary series. People eligible for a booster who are ages 18 years and older may get a different product for their booster. People eligible for a booster who are ages 5 to 17 years must get the same product, Pfizer, for their booster. Timing of COVID-19 vaccination after infection. People who have COVID-19 should wait to receive any vaccine, including a COVID-19 vaccine, until after they recover and complete their isolation period. Additionally, people who recently had COVID-19 may consider delaying their next booster by 3 months from when their symptoms started, or if they had no symptoms when they first received a positive test. Reinfection is less likely in the weeks to months after infection. However, certain factors, such as personal risk of severe disease, local COVID-19 community level, and the dominant COVID-19 variant, could be reasons to get the vaccine sooner rather than later. Special considerations for COVID-19 vaccines. There are special considerations to be aware of when administering the COVID-19 vaccines. Immunocompromised patients may be eligible for an additional dose. See the CDPH eligibility chart for timing and eligibility. Patients who received a vaccine in another country may be eligible for an FDA-approved booster. Check the WHO-approved vaccine list and the CDC interim clinical consideration for current guidance. Additional doses for moderately or severely immunocompromised persons. Each age group listed here is eligible for an additional dose of a COVID-19 vaccine. Children ages 5 through 11 years old should receive a total of 4 doses of the Pfizer pediatric COVID-19 vaccine. People ages 12 years and older should receive a total of 4 doses of an mRNA vaccine. Keep in mind, the Pfizer vaccine should only be administered to children ages 12 to 17 years of age. People ages 18 years and older who received J&J should get a second dose of either an mRNA vaccine, Pfizer or Moderna, plus an additional mRNA vaccine booster to stay up to date for a total of 3 doses. This is the WHO-approved vaccine list. The WHO-approved vaccine list provides pod staff with a list of international COVID vaccines that have been approved by the World Health Organization. This list also provides information on which vaccine product each patient should receive for their booster based on which WHO-approved vaccine was administered for their primary series. Make sure to use this list in combination with the CDC interim clinical considerations for use of COVID-19 vaccines currently approved or authorized in the United States. Appendix A reviews guidance for people who recently received COVID-19 vaccine outside of the United States. COVID-19 booster shot eligibility. Everyone ages 5 years and older can get 1 booster after completing their COVID-19 vaccine primary series. Pfizer or Moderna are preferred for the booster dose. However, J&J may be considered in some situations. The Pfizer vaccine may only be administered to children ages 5 to 17 years, and the pediatric formula should be administered to children ages 5 to 11. Certain populations are eligible for a second booster dose. Adults ages 50 years and older, people ages 12 years and older who are moderately or severely immunocompromised, and people who received 2 doses, 1 primary dose and 1 booster, of the J&J vaccine. Remember, second boosters can only be Moderna or Pfizer. Make sure if a vaccine recipient is receiving a Moderna booster that you inform the vaccinator that the Moderna dose will be a booster dose. The Moderna booster dose is a half dose instead of a full dose. Eligibility chart. This is the COVID-19 vaccine timing by age eligibility chart. On the left is the routine schedule. This is broken down by age, vaccine type, and when to administer the primary doses, booster dose, and second booster. On the right is the schedule for moderately or severely immunocompromised patients. This also breaks down by age, vaccine type, primary dose, including an additional third dose, booster dose, and a second booster dose. Keep in mind this eligibility chart is subject to change as guidance is updated frequently. Make sure to download the new eligibility chart each time the COVID-19 vaccine guidance is updated. The flu vaccine. Florex quadrivalent is currently the flu vaccine administered by Public Health. This is a pre-filled syringe and can be administered for patients 6 months and older. Patients ages 6 months to 8 years old, if not previously vaccinated with a flu vaccine, should receive 2 doses, 0.5 milliliters, at least 4 weeks apart. If the child has received an influenza vaccine in a previous season, they should receive 1 or 2 doses, 0.5 milliliters. Patients ages 9 years or older should only receive 1 dose. COVID-19 resources. It's important that all staff members provide patients with accurate answers to their questions. If a patient has a question about their vaccine or about a COVID-19 vaccine, we should refer them to documents from the CDC or CDPH. The CDC has a series of FAQ documents that provide answers to common questions. Staff should read through these and be able to refer to them when patients ask specific questions. The CDC also recommends that staff help enforce physical distancing and enhanced infection control measures. This includes maintaining a clean workspace, hand hygiene, and wearing appropriate PPE. Immunize.org has a checklist of current versions of U.S. COVID-19 vaccination guidance and clinic support tools. This two-page checklist includes the most recent versions of CDC's primary COVID-19 vaccination websites and resources. Make sure to have this at all sites. The EZAZ website also includes additional COVID-19 vaccination information. Electronic forms. Now that we've discussed the vaccine information, we'll review what information needs to be recorded via MyTurn. MyTurn. All clinics will use MyTurn for COVID-19 and flu vaccination clinics. MyTurn will be used at registration to check in patients, register walk-in patients, verify vaccination pre-screening questions, and confirm patient information matches the valid ID. Scribes or vaccinators will use MyTurn to review screening questions as needed and document each vaccination. Any immediate adverse reactions that occur during the clinic will also be recorded via MyTurn. Screening questions. Each patient who registers for an appointment in MyTurn has to answer a list of screening questions. These questions are the same questions provided in the CDC pre-vaccination checklist for COVID-19 vaccines. If a patient answers yes to any question, the registration staff should advise the patient to inform their vaccinator which question they answered yes to. If patients have additional questions, please refer them to a medical consult. Recording vaccinations. When recording a vaccination in MyTurn, the scribe or vaccinator will need to select the following information for each patient: the vaccinator who administered the vaccine, where the vaccine was injected, which route the vaccine was given, the date and time the vaccine was administered, which vaccine product was administered, and the lot number from that vaccine product. Once all of this information is selected, click Next to the next page, then click Complete. If needed, immediate adverse reactions can be added later. Note, each record locks 4 hours after the vaccination is recorded. Paper forms. Now that we've discussed recording information in MyTurn, we'll review how to document vaccinations on paper. This is our contingency plan. If the internet or MyTurn server are unavailable, there is a contingency plan in place to document vaccinations on paper, then enter them into MyTurn at a later time. All patients who receive a vaccination will need to fill out a screening and consent form for each vaccine received. The COVID-19 screening and consent form. This COVID-19 vaccination screening and consent form will be used for all patients 18 and up. The first page of the form collects the patient's identifying information and consent, and the back of the form contains all of the current CDC screening questions and an area to record the vaccination. We also have a COVID-19 screening and consent form for minors. This COVID-19 vaccination screening and consent form for individuals under 18 years of age will be used for all patients who are under 18 years old. The first page of this form collects the patient's identifying information and guardian consent. The back page of this form contains all of the current CDC screening questions and includes an area to record the vaccination. Note, patients under 18 years old who did not pre-register on MyTurn with guardian consent will also need to fill out the first page of the minor consent form. If the patient is entered in MyTurn, they do not need to fill out the second page. Flu screening and consent form. The influenza vaccine screening and consent form is 1 page. This form collects the patient's identifying information, screening questions, as well as consent. Vaccination record card. Now that we've discussed recording vaccinations on paper, we'll review how to document both flu and COVID-19 vaccines on vaccination record cards. Documentation of COVID-19 vaccination. For all COVID-19 vaccines, vaccinators will document each COVID-19 vaccination on a physical CDC vaccination card. One card may be used to record first, second, additional, and booster doses for a single patient. There is additional space to record a vaccination on the back side of the card. Documentation for flu vaccination. For flu vaccines, the patient will choose whether or not they would like a vaccination record on a vaccination card. If the patient requests their flu vaccine to be documented on a vaccination card, it may be recorded on either the patient's yellow immunization card or the documentation of influenza administration form with the public health department's information filled in, as seen on this slide. Safety plans. Now that we've discussed clinic setup, staff roles and duties, and vaccination documentation, we'll briefly review the clinic's safety and quality assurance plans. Vaccinator quality assurance. At each clinic, the pod manager may designate a nurse or doctor to observe infection control practices and proper technique. This individual should observe all vaccinators to make sure they are vaccinating correctly and safely. If they notice an issue with the vaccinator's technique, they should approach them to help correct the issue. The designee should also provide input to the vaccinators and answer any questions that may arise. This individual should also ensure all vaccinations are properly documented on the vaccine cards and in MyTurn or on paper forms. And vaccine errors and adverse events are properly documented into VERP or VAERS. Any vaccine administration errors, such as administering an incorrect dose, should be immediately reported to the pod manager, who will determine the appropriate corrective action. In addition, all administration errors should be reported to the Vaccination Error Reporting Program, VERP, and the PhD Immunization Branch. If a patient has an immediate adverse reaction while at the clinic, our staff will provide medical attention or call 911. In addition, the adverse reaction will need to be reported to the VAERS and Immunization Branch. CDC recommendations for vaccine preparation and administration. The CDC recommendations for the vaccine preparation and administration provide safety procedures for all medical staff to follow while administering vaccinations. Triple check labels, contents, and expiration dates and beyond use dates before administering vaccine. Never use expired vaccine or vaccine past the beyond use date. Check the 5 rights: right patient, right drug, right dose, right route, and right time. Ensure appropriate needle size and technique. Administer the correct dosage via the correct route. Document the vaccination upon completion, and take corrective action immediately if a vaccine administration error occurs, and put strategies in place to prevent future errors from occurring. Quality control. It is important to ensure the following information is correctly entered into MyTurn. The patient's legal first and last name. We want to make sure there are not nicknames. Date of birth, cell phone and/or email address. When recording vaccinations in MyTurn, make sure the correct vaccinator's name, route, vaccine product, and lot number are selected. Slow down and double check the information on each screen before continuing to the next page. When using paper forms, it is also important to double check the patient's information. When reviewing the patient's information, ensure all areas of the form are filled out and everything written on the form is legible. Make sure to rewrite any information that is not easy to read. If you have any questions about documentation, check with the pod manager. Medical emergency plan. All staff at each pod should be familiar with the medical emergency plan for the clinic. Before starting each clinic, all staff will receive a briefing that details the medical emergency plan for the clinic. During the briefing, the EpiPens and AED will be assigned to specific individuals at the clinic. All sites should have the following medical supplies: EpiPens, AED, CPR masks, blood pressure cuffs, stethoscope, first aid kit, cots, and ammonia inhalants for syncope. All staff should know where the EpiPen, AED, first aid kit, and all other medical supplies are located. In the event of a medical emergency, remain with the patient and call out for help. If 911 is needed, designate someone to dial 911, and meet emergency personnel to direct them to the patient. Anaphylaxis. If anaphylaxis is suspected, take the following steps. Call for emergency medical services, 911. Rapidly assess the airway, breathing, circulation, and mental activity. Place the patient in a seated position of comfort with the ability to place patient supine if needed. Epinephrine auto-injector EpiPen is the first line of treatment for anaphylaxis and should be administered immediately. Take vitals every 5 minutes until stable or otherwise directed by medical consultants at the pod or care turned over to 911 response. Using an EpiPen. Only trained medical professionals may administer epinephrine. Note, when using an EpiPen, the dosage administered is determined by the weight of the patient. Individuals who weigh more than 66 pounds should receive the EpiPen for adults, 0.3 milligrams. Individuals who weigh 33 to 66 pounds should receive the EpiPen Junior for pediatrics, 0.15 milligrams. Individuals who weigh 16.5 to 33 pounds should receive the AUVIQ for instance, 0.1 milligrams, which is not available at our clinics at this time. Each box of EpiPens contain a trainer for medical staff to practice with prior to the clinic. See pod or vaccine manager for assistance. EpiPen video. This video reviews how to use the EpiPen epinephrine auto-injector, which is available at all of our clinics. All staff should have a valid American Heart Association CPR certification and know how to use an AED. If a person becomes pulseless, start CPR, direct someone to call 911, and bring the AED to the patient. This video reviews how to use the Zoll brand AED, which is available at all of our clinics. Incident report. If a medical or safety incident occurs during a clinic, an incident report must be filled out to document the situation. This will be completed by the pod manager or safety officer. After an incident occurs, the pod manager or safety officer should gather information from the clinic staff and patient as needed, complete and submit the incident report along with any additional follow-up information to the supervisor after the clinic, and work with the supervisor to submit any vaccination errors to VERP or any immediate adverse reactions to VAERS. Traffic safety plan. At each clinic, it is important to have a traffic safety plan. For each site, identify where patients and staff can park. If possible, keep patient areas away from parking spaces to limit the danger of vehicles driving around pedestrians. If the clinic is a walk-up only and not a drive-through clinic, ensure the clinic area is blocked off from any vehicle access. Sometimes drivers may mistake an outdoor clinic as a drive-through clinic. By blocking off these areas, we can help keep everyone safe. For larger clinics, it may be helpful to have staff directing traffic. If so, this person must wear a high visibility vest and should consider holding a light stick or slow stop signs. Weather plan. Outdoor clinics are subject to all types of weather. Make sure to check the weather often and plan accordingly. Inform staff of any notable forecasted weather ahead of time to ensure all staff members are aware and wear the appropriate clothing. For cold, wind, or rain, staff may want to dress in layers. If tents are being used, they'll need to be secured with weights. Plan to use tents to cover all areas of the clinic. For hot temperatures, bring plenty of water for both staff and patients. Plan to use tents to cover all areas of the clinic. Pack extra cold packs for patients and to keep the vaccine cool on the tables. Find shaded areas for the vaccinators and make sure to keep the vaccine temperature within range. Press and media and public information officer. Each mobile clinic is considered a medical facility, therefore HIPAA laws apply. No one may take photos, videos, post information on social media or contact the press during a clinic. This includes using video chat such as FaceTime or Duo. This is not allowed because there may be patients in the background, and that's a breach of confidentiality. If the media arrives at a clinic and asks to record, contact the PIO immediately. Only the PIO may speak to members of the press. Patient consent to photograph. Anytime a representative from public health photographs individuals, a consent form must be filled out by each individual photographed. Now that we've completed reviewing all of the information in the pod training, it's time for a quiz. At the end of this presentation, please click on the quiz link in your email to take the 10-question quiz. If you have any questions, please reach out to your supervisor. Resources. Make sure to stay informed and stay current. Here are a list of current resources. Note that these may be updated frequently, and so check these often. Thank you for watching today's pod training presentation. Please reach out to your supervisor if you have any questions. As a reminder, to complete this training, you'll need to 1. Watch the EpiPen video, 2. Watch the Zoll, CPR, and AED video, and 3. Take the pod training quiz. If you have any questions, please reach out to the supervisor. Thank you.